Now let's discuss an important optical defect seen in high plus lenses called roving ring scotoma. In high plus lenses, the edges of the lens act like a prism. Specifically, they act as a base and prism. So when the light rays strike the periphery of the lens, they are bent towards the center. Because of this strong prismatic effect, some light rays from the peripheral objects are deviated away from the pupil. Therefore, these rays do not enter the eye. As a result, a part of visual field is not seen, creating a blind area. And this effect occurs all round the edge of the lens, so the blind area forms a ring-shaped zone surrounding the central vision field. So why is it called roving? Because the scotoma is not fixed. As the eye moves behind the spectacles, the position of the blind area shifts. So the scotoma appears to move or rove, hence the name roving ring scotoma. Now, patient may complain that objects suddenly disappear or reappear at the periphery, and there will be difficulty in mobility, especially walking or crossing the roads. Now, I will explain an interesting visual phenomena seen in patients wearing high plus aphakic glasses called jack-in-the-box phenomena. This refers to sudden appearance or disappearance of objects in the peripheral visual field. It occurs due to the presence of ring scotoma created by high plus lenses. As discussed earlier, high plus lenses produce a roving ring scotoma. This creates a blind ring zone in the mid-peripheral field. Objects located in this zone are not visible to the patients. So when an object lies within the scotoma, it is not seen. And as the patient moves their eyes or head, the object suddenly enters the visual field. So the object appears to pop into the view suddenly. This is why it is called jack in the box, like a toy suddenly popping out. Bottom diagram, left image, the object lies between the approximately 50 to 65 degree within the ring scotoma, and light rays from this object do not reaches the retina. So the object is not perceived. And in the right image, when the patient moves the eye, the image shifts so that the rays now passes through the central part of the lens, and the object now becomes visible suddenly. So key point here is that the object was always present, but it was hidden in the scotoma and then suddenly appears. The clinical significance is it can be very disturbing and confusing for the patient. Also, the patient feels that the objects are suddenly appearing and jumping into the view, which causes difficulty in walking, driving, or detecting obstacles. So jack in the box phenomena is a sudden appearance or disappearance of peripheral objects due to their movement into or out of the ring scotoma in high plus lenses.